Nisa Hospital, situated in Jabi, the heart of Abuja, was established in 1996. Nisa is a brainchild of Dr. Ibrahim Wada, a renowned gynecologist, bringing smiles to the faces of couples struggling with conception.
My role today is to introduce the hospital to you and all its ramifications before we focus on the fertility and in vitro fertilization program. Nisa was founded in 1996 by myself, and it has really grown from a simple primary care center. It has become an advanced tertiary care center in the heart of Abuja, Nigeria. And let me take you through each of the departments that we have. To begin with, we started as a fertility center, but it's one that is capable of in vitro fertilization and even genetic analysis. Anything done in infertility in the world is available with us at Nisa Premier Hospital. Then we progressed to antenatal care and deliveries, and this period we're doing more than 1,400 deliveries every year, so it's a growing program of maternity care here. Then we have a strong neonatology unit so that the newborns are well cared for, well catered for. Premature children, children with all sorts of problems born, we look after them at Nisa Premier Hospital. The entire pediatric spectrum, that is the older children, they also find a place of care here at Nisa Premier Hospital. We have consultant pediatricians, other consultant gynecologists, neonatologists. All of those specialists are here, and the places are fully equipped to do what they're supposed to do for the healthcare. Now, as a foundation to all of this, because health insurance has grown in Nigeria now, we have a family medicine department that looks after the entire family, especially in their more common illnesses. Attached to this are people who look after specific illnesses like the heart and the kidney, and surgeons. They all practice under the family medicine scenario. Nisa is advancing because very recently we've installed facilities like the MRI, CAT scan, CT scan, also advanced intensive care units, and very, very advanced theaters for major surgeries, and many, many executive wards. So Nisa is a growing organization that nurtures the full spectrum of healthcare, but it is well known in this country for infertility and in vitro fertilization.
The hospital is headed by a medical director, supported by a team of highly qualified clinicians and administrators, each person contributing their quota immensely to the smooth running of the organization. Our primary goal is to deliver quality healthcare at par with international standards.
At Nisa Premier Hospital, when the patient comes in, a detailed evaluation is carried out. It starts with a proper history taking as well as an examination. And various investigations are carried out, including the hormonal assay, the pelvic ultrasound scan. And these investigation results are reviewed. And depending on what we get from the investigations, the patients are treated appropriately. And if there are other pathologies that may interfere or affect the treatment outcomes, these pathologies are properly taken care of first before the IVF treatment proper. The IVF processes include the steps that are carried out from the point of stimulating these ovaries to the point of embryo transfer and the processes that follow thereafter.
In the IVF laboratory of Nisa Premier Hospital, the extracted eggs from the woman is mixed with her husband's sperms to achieve fertilization. Embryos are generated for possible embryo transfer into the woman's uterus for conception. In a situation where you have excess embryos, it can be cryopreserved for as long as 50 years. In Nisa Premier Hospital, we guarantee the first 25 years of cryopreservation. It is also possible that the eggs extracted from the woman can be cryopreserved for future use in order to generate embryos. The man can also preserve his sperms for future use, as the case may be. Where embryos are generated and the couple are interested in checking the health status of their embryos, the embryos undergo a procedure we call biopsies, where the cells are removed so that you can check for the normalcy of the embryo, and they are guaranteed that they will have a healthy baby. In a situation where there are diseases like sickle cell anemia, the same embryo, you can extract cells from it and take it to the genetic lab for genetic diagnosis.
At Nisa Premier Hospital Genetics Lab, our aim is to screen embryos and try to detect these single nucleotide mutation in hemoglobin beta gene to try to differentiate between AS, AA and SS embryos and try to transfer the healthiest embryo possible, achieving the healthiest pregnancy possible.
As IVF nurses, our roles are diverse. We educate our patients, we counsel them, we administer injections, we are actively involved in folliculometry. We also act as a bridge between the patients and the clinicians. We are actively involved in follow-up of our patients pre, intra and post-treatment.
The counseling department of IVF Nisa Premier Hospital exists to cater for our clients' needs, especially those who are going through fertility challenges. The challenges are so much that it exerts pressure on their emotions, on their social life, on their work and everything around them. Normally, when they come to the clinic, after seeing the doctor, they get referred to see the counselor who helps them through the process of treatment. We do counseling at the beginning of treatment, during treatment and at the end of treatment.
And we are looking forward to partnerships across the globe to export the abilities and knowledge that's available to us to other countries.